Well, many of us have gotten relief from a chiropractor's adjustment.
Kids can benefit too, as we're about to see.
Yes, welcome back to the Morning Blend. Chiropractor Amber Wills from Real Results Fitness and Health. Joining her is her 3-year-old son, Kenny, who's ready for an adjustment. Good morning, guys. How are you? Kenny, how are you, buddy?
3.
You're 3. Yes, that's right. He is 3. That's very good. Thanks for telling me about that. When we talk about chiropractic care in general, how do you explain it to people? Because I've been a patient of chiropractic care for many years. It prevented me from getting a surgery about 7 years ago, so I'm a strong believer. What do you tell people?
Chiropractic care is actually very closely associated to low back pain, and that's what people really think, like, oh, my back hurts, I need to go to a chiropractor. When actually chiropractic care is so much more than that, and it's actually really closely associated to taking care of your nervous system. Your brain is actually what is your central computer and actually what coordinates every single function in your entire body. And even though we've had great advances in technology and Wi-Fi and everything else outside of the body, your brain is always going to be hardwired through your spine and down to the rest of your body. So even though we've made great advances in technology everywhere else, since we're still going to be hardwired, anytime there's any interference in there, subluxations really affect that brain-body communication.
You hear that term thrown around a lot. I, too, have been a huge advocate for chiropractic care. Tell us what a subluxation is.
A subluxation is the chiropractic term for misaligned vertebrae in the body. Subluxations cause interference or pressure on the delicate spinal nerves that come out between the vertebrae, and when that pressure is interfered or has any dysfunction there, it just affects everything throughout your entire body. So it can affect digestive issues, it can contribute to asthma, it can contribute just to a lot of different things throughout the body, and a lot more than just low back pain.
My oldest son, when he was 2 years old, he had chronic sinus infections.
Mm-hmm.
So one of the things that we explored was chiropractic care and these adjustments. And Kenny is going to get an adjustment today.
Right.
And on kids, how do you, what does it treat when you work kids into chiropractic care?
It can affect a wide range of different symptoms that kids come in with. A lot of times kids deal with like bedwetting issues or constipation or, like I said, asthma before, ear infections, eczema. There's just, the nervous system controls everything, so anytime that it's not functioning correctly, it can produce a whole host of different symptoms in the body.
We're looking at these pictures and all these kids are smiling in these pictures.
They
so
sure are.
This doesn't hurt.
No, it does not. The way that an adjustment would be performed on you is completely different than a way it would be performed on a child. The force, that's some little munchkins there. Yeah, the force is completely different and the adjustment is completely different.
Look at Kenny. He's like, man, are we going to do an
like,
adjustment
whatever.
or what?
I've done this
He climbed
before.
up on the bench. He's ready to go. Should we get to Kenny right now?
Sure.
So what are you going to do
Absolutely.
for Kenny, and what do you use chiropractic care to treat him for?
So actually he's been adjusted since birth. So he has never actually suffered an ear infection. He's never dealt with croup. He's never dealt with RSV. He's never dealt with a lot of the typical child illnesses just because he has been adjusted.
Right. And it looks like he knows the routine.
He's like, let me just
Absolutely.
I know
assume
what
the
I'm
position.
I know what I'm doing here.
I have had friends that swear by this who have had children with chronic ear infections.
Absolutely.
And they have, tried all kinds of pharmaceutical options, and then finally they go. And
Yeah. Well, when Grayson, his sinus infection's cleared up.
So that's what we
So
call,
what did you just do right there? What are you doing?
That's what we called the pretzel pancake.
Okay.
So we folded him up like a pretzel and we squished him like a pancake. And so that was adjusting his hip there. So it kind of helps with kids, again, like I said, with bedwetting or if they get constipated, things like that with some of the stuff that they're eating.
And you can tell it doesn't hurt him. I mean, he's just as relaxed as he could be.
He's pretty used to what's going on here. So, and then right now we're just doing a cervical adjustment. And it's just that simple. It's that quick and
You're not cranking the neck around.
not at all.
And there's no popping, by the way, for anybody. We don't hear any pops or cracks in the studio. I think people have that association, too, with chiropractic care, that there always aren't these loud cracks that go on. That's sort of a
Absolutely.
myth.
Sometimes the kids hear it.
Sure.
It is right next to their ears. And that we just did a thoracic adjustment right in the middle there.
Yeah. Kenny, what do you think? Is everything going good for you? Does that feel good? It does feel good? How long have you been getting chiropractic adjustments? A long time, right?
You are
Your
lucky
whole life.
to have a mommy who can do that, right?
That's right. And realresultsomaha.com is your website. Do you treat kids? Do you treat adults as well? Do you treat everybody?
Exactly, whole family care. My most seasoned patient is going to be 83 years young this month. So,
And infants as well.
And infants as well. My youngest
Wide
is 2
range.
months right now. So
Wow.
How often should we get checked?
It really depends. Everybody's maintenance is a little bit different. With my own family, I check them once a week, and if they happen to be, you know, my son or my husband, if they happen to be like suffering from a cold or something like that, they get it checked and adjusted more often, more like daily. But a good maintenance plan and recommendation is about once a week.
What are one of the most common symptoms that you see? I mean, is it back pain, or are there other issues? I guess what's the most common ailment that you see from your patients?
I do. I have lots of patients that come in that are preventing their back pain from getting any worse. I have lots of patients that come in. Right now I've got a couple of kids that come in with some ADHD issues, and their mom doesn't want them to be on medication for anything like that. So a lot of anything that the nervous system is related to, you can come and probably see a chiropractor for it.
Can you tell us about any really dramatic stories where you've seen chiropractic have some pretty remarkable results?
I had a little guy come in that suffered 2 strokes during the birth process, and so he had a lot of right side deficit, motor deficit, and some feeling and sensation. So we got his right side moving a little bit better and just really helped him.
You saw improvements.
Yep,
That's
absolutely.
great. Kenny, what are you doing over there, buddy? You're kind of wandering around the studio. Do you like it in here?
Lots
Pretty
to look
neat.
at.
Lots of lights, lots of TV monitors. That's awesome.
Husker Red, Valentine's Red, I love that.
You can find Dr. Amber Wells at Real Results Fitness and Health LLC, 4649 South 136th Street. Where exactly is that?
We are right on the corner of 136th and Old L, so right down the street from the old digs.
Right there, and the phone number 915-2626. Again, realresultsomaha.com. Kenny, you did a good job this morning. Thanks
Great
for coming,
job.
buddy. Doctor, thanks for coming this morning.
Thank
Good to see
you.
you. All right.